region on alert after patient with symptoms quarantined. As fears over the spread of Ebola to Latin America increase, more safety measures have been implemented on possible carriers of the deadly disease, leading Chile to quarantine a patient reporting symptoms that were consistent with the virus yesterday, only 2 days after Brazil hospitalized one last week. In response to this growing threat, the local health ministry established a protocol in case a patient is found infected with Ebola. A 54-year-old Chilean patient was hospitalized yesterday after reporting to have symptoms similar to Ebola, but the country's health ministry played down the risk, claiming that he had a low chance of actually having the virus. The man, who has Chilean nationality, had arrived a week ago from Equatorial Guinea, one of the 3 West African countries worst affected by Ebola. According to the established protocols, the patient was isolated immediately to examine his health and prevent possible contagion in the hospital center, said Chilean Health Minister Helia Molina. However, the official assured the public that the chances of it being Ebola were low. Brazilian test negative. A Guinean man suspected of having Ebola tested negative for the disease over the weekend after he was quarantined on Thursday upon his arrival in Brazil, in a case that raised regional fears about the spread of the disease. Although some claimed the 47-year-old had entered Brazil through Argentina, migrations authorities quickly denied that was the case. First U.S. Ebola infection. The latest regional scares with the Ebola virus that has already killed more than 4,000 people came on the same day as the first case of U.S. transmission was detected. A healthcare worker in Dallas has tested positive for the virus, suggesting she was wearing protective gear while treating an Ebola patient who died.